weren't a lot of abnormalities on the lab work. Her kidney and liver and thyroid values were normal, which is good for a cat her age.
Okay.
But she did have a fair amount of anemia, so her red blood cell count was pretty low.
Okay.
Which, if you recall at the visit, I did note that her gums were a little bit pale.
Yes.
Yes. And I was a little concerned she might have some anemia going on. She's not at a level that would necessarily need like a blood transfusion, but it was a moderate level there on how low it had gotten. So it's definitely something we'll have to monitor. And if she starts to seem suddenly weaker, or more lethargic than she has been,
okay.
or if her gums appear very pale, that may be an indication she does need to have that done.
Okay.
But those findings on the lab.
I remember what you told me. The other day.
that makes me more suspicious of something cancerous going on.
Okay.
With her physical findings. So, at this point, then like we had kind of chatted about, we either decide if we want to look into that further to try to confirm and identify the ultimate cause and see if it's something that we can do some treatment for, or we may say let's trial the steroids for a more palliative care approach, and then you can give her something for the diarrhea if it's not improving on a probiotic, that kind of thing.
Quick question, Dr. Levine.
Go ahead.
The results of the stool analysis, is it out yet?
That is no parasites were seen on that as well. There was no Giardia or Coccidia or worms were noted, which is good.
Okay.
So the diarrhea, my suspicion is maybe some type of like intestinal cancer.
Okay.
But that's somewhat common in older cats, and a lot of times it will affect like their absorption of the water and nutrients from their food. So within the digestive process, they may have the vomiting and the weight loss, and they may have like their stool will be abnormal, because it's not passing through normal tissue,
right.
Normal intestines. So that would raise my suspicion there. But we do check the stool because sometimes we have a pet that has a severe parasite load. I mean, if she were an outdoor cat, I'd be a little more worried about that too,
Right.
But it's possible in indoor cats, so we have screened her for that, but we didn't find that there.
Okay.
And her this panel includes viral testing for feline leukemia and feline AIDS, and that was also negative, which is good. But, because actually those two viruses can cause some cancers themselves. So if we have those, then that would give us more of our diagnosis. But right now, my top suspicion is maybe some type of, stomach or intestinal tumor is in there.
Okay. I think my husband has a question for you.
Go ahead.
Hi, doctor. So, what test is next to see if it is
Ultrasound.
Is it ultrasound or biopsy, or what is the?
Well, typically what we'll start with is some scans.
Okay.
So we'll do some chest X-rays to evaluate the heart and lungs and see if there's any tumors found there,
Okay.
Or any disease process there. And then for the abdomen, we'll do a sonogram or an ultrasound first. It's kind of, we're scanning all of the internal organs, the liver, kidneys, the stomach, the intestines, their bladder, their lymph nodes, see if we find any specific areas that are affected. In some cases, sometimes multiple areas are affected. And then depending on those findings, sometimes there are some samples that can be taken with the ultrasound guided itself, like a fluid analysis, if there's a pocket of fluid somewhere, or a needle aspirate of like a thickened or inflamed, area that may be like a tumor.
Okay.
In some cases, depending on the findings on those scans, they may recommend more like a true biopsy, which would be done generally, depending on the location. If it's somewhere in the digestive system, they can do an endoscopic biopsy where they, would take a little camera down the throat or, the other end and take a biopsy through that without a surgical incision.
Yeah, it would just be a tiny incision.
Like like it's more like a tumor, like on a different organ, then they may, and if we want to get a biopsy of it, then we would do more like a full, like a surgical biopsy. Sometimes we'll refer them for a laparoscopic biopsy too. They do that at the larger veterinary hospitals. And then depending on those findings, I mean, sometimes the biopsy is needed, sometimes we get our findings from scans. If a cancerous process is found and an ultimate diagnosis is reached, an oncology consult, I mean, just like in human medicine, you can pursue, a little bit more advanced workup and treatment, get a more specific with our treatment. And some of that does depend on, how widespread the issue is, and because that does affect the prognosis. So, at each stage of that workup, we would be discussing with you guys, whether it's recommended to keep going or to stop and start some treatment, more for what's going on with the symptoms.
Mm-hmm.
But, that's definitely one route, you can go.
Yeah.
And then, aside from, doing a lot of that work, I mean, some people want to do at least the start of it to kind of get more of a confirmation of, yes, we did find kind of an issue here. Maybe we're not going to go full on and do like a whole biopsy and stuff, but at least we know what was probably going on.
Right.
And then start treatment. If we're doing more like, we want to get more into like, chemotherapy, which I know I kind of briefly discussed with you at the appointment that, they do tolerate it well. The oncologists do tend to like to have like a more definitive idea of what cancer they're treating, because that will direct which medication they may choose. But if we're doing more like the, palliative care, we don't always have to have an ultimate diagnosis.
Right.
So it really just depends on, your comfort level, and also, how she's doing with everything.
So, you mentioned palliative care. So, does that pertain to the steroids?
Sorry, can you repeat that? The story that I didn't quite catch.
Yeah, when you mentioned palliative care for her,
Uh-huh.
right? So does that entail the steroids? So
generally, for cats, steroids are considered palliative care. Sometimes they are added to chemotherapy protocols as an adjunctive therapy.
Okay.
But when they're used alone, they are typically considered palliative because what they do is they reduce the inflammation associated with the cancer, and kind of slow it down in some cases, depending on the type of cancer. Some actually will slow down a little bit with steroid use.
Right. Does it?
And they just generally, because they're anti-inflammatory, make the pet feel, more perky and better, and their appetite improves, and
will
that kind of thing.
Will that reduce her pain if she's in any
It can
pain?
if there's discomfort associated with it because it reduces inflammation.
Okay.
If we do feel like a patient seems, overtly painful, in a certain area, we also can start them on pain management medications as well as the steroid. They can be used together, and there are some cases where we feel that may be needed. She did seem a little tender in there.
Yeah.
When we were kind of palpating and stuff. So sometimes we'll see how they do on the steroid itself, and if they seem improved,
Right.
then, we'll be happy with that. But if they're maybe still a little punky there,
Right.
we may try pain meds too before we say that we're just not getting any kind of
Right.
response, and of course, at any stage, if the patient doesn't seem to be responding well or seems to be declining despite these, attempts, then we have to make a quality of life decision sometimes. But it just depends on each pet's individual response, where sometimes we don't know how they're going to respond until we try. Definitely, I mean, if we did some other scans and stuff, and we found, for example, if we found that there was, areas of concern in her chest and her abdomen, and that multiple organs were affected, that is going to reduce our long-term prognosis a lot more, because if it's, some cancers are very aggressive and move very quickly and can have spread, to lots of areas before the pet even has symptoms. Then, we just don't have a lot of time left to get any kind of response, versus if we find, well, there's just one kind of major area, the rest of their, body's still functioning okay, then we may get several months, I mean, sometimes we get, a year or more, in more rare cases, but, it's possible.
Right.
And then I've had some pets that we didn't find super, super severe disease, and we started some treatment, but the pet still, seemed to get worse over a few weeks, and we just had to kind of, make a judgment call based on that,
Right.
because